Welcome back to HPHA's Pre-Admission Patient Education for Hip Replacement Surgery, Module 2, Before Surgery. There are many things you must prepare before coming to the hospital. In this section, you will learn about home setup, homemaking, bathroom, seating, exercise, bundled care, equipment, dressing supplies, and checklists. Don't forget you can follow along in your booklet from pages 11 to 18. Patients who are prepared for surgery and who take part in their care can recover in less time, with less pain, and regain their independence. Planning to go home from the hospital starts before you have your surgery. Your time in hospital after the surgery is short. It is important to set up your home before joint surgery. This helps decrease your risk of falls and maintain your hip joint precautions, those basic rules. If you have steps, it is best to install hand railings at your entry steps. Decide which entry will be the best to use after your surgery. Clear hallways and spaces in and around the bed, kitchen, and bathroom. Remove area rugs. This will allow you to move freely and safely with your walker. Ensure good lighting in hallways and other well-used areas. Wear non-slip supportive footwear. Wear eyeglasses as required. Do not try to move too quickly. See page 11 of the booklet for many other suggestions to help you prepare your home after surgery. It is best to have someone stay with you after you return home for the first week or two, or consider whether you could stay with someone else during your recovery. If these aren't an option, some retirement homes offer a respite stay, which is a temporary accommodation to assist with personal care while you recover. You must make these arrangements in advance of your surgery. Stock your freezer pantry with healthy foods and snacks. Temporarily move frequently used household items to counter height. Consider moving items in the lower parts of the fridge or freezer to a higher shelf. Rather than bending over to use the oven, use a microwave or toaster oven at counter height. See page 12 of the booklet for many other suggestions to help you prepare your home to maximize your safety when you return home. Install a raised toilet seat or commode with armrests to help you stand up. Use a non-slip bath mat both inside and outside the bathtub or shower. Consider buying a long-handled bath brush. Install a handheld shower head, which makes bathing easier while sitting. When sitting, you want your hips to be slightly higher than your knees. A good rule for seat height is 2 inches above your knee. Use chairs with firm seats and arms, straight backs, and avoid sitting on soft chairs, couches, and rocking chairs. Set up a table beside your chair for frequently used items, as you will not be able to bend forward to reach items off the coffee table. See pages 12 to 13 of your booklet for many other suggestions to help you prepare your home to maximize your safety when you return home. Take a few moments to watch the following video. It will demonstrate the proper way to do these exercises. If you are able, you should be completing exercises 1 to 6 at least once daily until your surgery. You'll find these exercises on page 24.
These are the exercises for the total hip replacement. Please follow along in your exercise book. First exercise is deep breathing and coughing. We ask that you do 10 deep breaths, followed by 3 coughs every hour that you're awake. Exercise 2, ankle pumps. Pump your ankles up and down 10 times every hour that you're awake. Exercise 3, quad sets. Push the back of your knee down against the bed by tightening the muscle on the front of your thigh. Hold 10 seconds, repeat 10 times. Exercise 4, gluteal sets. Tighten your buttock muscles together, hold 10 seconds, repeat 10 times. Exercise 5, knee over the roll. Place a roll under your operated leg. Keep your knee pressed down into the roll and lift your foot to straighten the leg. Hold 5 seconds and slowly lower back to the bed. At home, you may use some tightly rolled blankets or a juice can with a towel wrapped around it. Exercise 6, hip and knee flexion. Bend your hip and knee by sliding your foot up along the bed. Slowly lower it down. Repeat 10 times. If you need to, you can use a plastic bag under your foot to make it easier to slide.
The following information can be found on page 16 of your booklet. Prior to your surgery, you will need to get equipment to help you get around after your surgery. This equipment can be rented from medical equipment vendors for periods of 1 month at a time. You must have this equipment in your home before coming to the hospital for your surgery. A list of vendors in your area can be found in the booklet on page 40. Before your surgery, you will need to obtain the following equipment: a standard walker, one without wheels. This gives the best stability. A cane for getting up and down the stairs. Crutches. If you do not have a railing at your stairs, you will need to use crutches to get up and down stairs. You will also need to rent the following equipment: a raised toilet seat with grab bars, a tub transfer bench, unless you have a walk-in shower. If you don't already have them, we recommend purchasing several soft gel ice packs for pain and swelling after your surgery. Bundled care is a service for all patients having single or one-sided hip and knee replacement. This service helps to ensure that you have all the supports in place to recover and gain your independence as soon as possible after surgery. All patients will be assessed before surgery to determine the most appropriate course for post-surgery rehabilitation. Patients must choose an outpatient physiotherapy clinic in the community before their surgery. There are a number of outpatient physiotherapy clinics that you can choose from. You can find a list of these clinics on the HPHA website at www.hpha.ca. Patients must choose an outpatient physiotherapy clinic in the community before their surgery and book an appointment within 1 week post-surgery. Physiotherapy is treatment by trained healthcare providers, which helps to restore and make the best of your mobility, function, and well-being. You must arrange your outpatient physiotherapy visits before coming to the hospital. These will be reviewed and discussed with your pre-admit nurse. Your first outpatient physiotherapy visit should be scheduled within the first week after you come home from the hospital. Please write the name of the clinic and your appointment time in your booklet. After your surgery, you will have an incision or cut on your hip, which will be covered by a dressing or bandage. This dressing needs to stay in place for 7 days after your surgery. 7 days after your surgery, you will need to change your dressing at home. We'll talk more about this later. It's best to buy your dressing supplies before your surgery so you will be prepared. You will need to purchase the following items at your local home or health store: 1 bottle of normal saline, 2 large Medipore Plus strip dressings, and 1 box of 4x4 gauze pads. You will find 3 checklists on pages 17 and 18 for things you need to do before coming to the hospital. Please complete the checklists prior to coming to hospital. Module 2 Summary. There are many things to prepare before you come to hospital for your surgery, such as special equipment, bandage supplies, and physiotherapy appointments. It's important to have everything ready before surgery so that you can stay safe and healthy while you are recovering. Remember, if you do not have someone to stay with you after your surgery, you can use the respite care offered by many retirement homes. Please use the checklists on pages 17 and 18 of your handbook so that you are prepared before you come to the hospital for your surgery. That brings us to the end of Module 2. When you're ready, please review Modules 3 and 4.